Hi, my name is Katie Hettinger, and I'm currently a PharmD candidate at Butler University in Indianapolis, Indiana. I also currently work as a certified personal trainer on campus in our health and recreation complex. And I started training as a way to express my love for exercise and health and to help others in the process. But the further I have gotten in my pharmacy studies as far as medication management, the more I see how exercise can be fundamental in our patients' health, especially for things like pain management. But that can get really tricky. Who is the best resource for pain management references and assistance for our patients? A personal trainer, a doctor, or perhaps a physical therapist? So today I brought in Cris Lubrick, a physical therapist here in Indianapolis, to talk about this topic and how we can use our specialties to best benefit our patients and clients. So thank you so much for joining me today, Cris. Before anything else, what led you to physical therapy?
So I was an athlete in high school and had some just kind of regular injuries. First, a running injury, and I had physical therapy, and it just really struck me as something that seemed fun and interesting. It was kind of the perfect mix for me of mental and physical, working with people, all of those things that just seemed like a good fit for me. And then actually I had another injury a little later in high school, and I had not the best experience with a physical therapist, and that kind of solidified my decision to go ahead and move forward with physical therapy, because I felt like I had an example of what I wanted to be, and then also an example of what I didn't necessarily want to be in a physical therapist.
That's awesome. I'm sure your personal experiences have really been able to help you empathize with your patients and really know what they're looking for in a physical therapist and the experience that they're hoping to have. In healthcare, especially, that's a really good thing to be able to do, is put yourself in your patient's shoes and really think about the experience that they're looking for, what they might be feeling, what they're going through. And that being said, what would you say your average patient population is? What kind of patients are you working with on a day-to-day basis?
I've always been in the outpatient orthopedic setting, so always working with a patient population that is usually in pain because of an injury or just kind of long-standing chronic pain.
And what % of your patients would you say are experiencing that chronic pain?
I would say probably 90%.
Okay, so a lot of your patients are experiencing pain.
Occasionally, so I may have a patient who is maybe an older patient who is just kind of debilitated or weak and is having a hard time with their normal daily function. So I might just be working with strength. Or I may have a patient that maybe wants some injury prevention or knows that they have some weakness in a certain area and they want to work on it. But in general, most people are coming to me because they are in pain.
I like how you brought up kind of working to decrease the medications that patients are on by using different modalities such as exercise. And aerobic exercise has actually been shown to be really beneficial, as well as a lot of strength and stretching work, and those have also been cited to help with pain. So besides those exercises and working with patients that way, how else do you evaluate pain? How do you know that what you're doing with your patients is working to help alleviate their pain?
So I am asking them how they would rate their pain on a 0 to 10 scale every day. And sometimes we will use that as, kind of a retest at the end of the treatment for how do you feel like your pain is now. I don't always feel like it's a super reliable way to get a good feeling for maybe how someone's function has improved or maybe how their movement has improved, which could still have the same level of pain, but now they can move more or they can squat deeper or that sort of thing. So I'm assessing many different elements within the session aside from just their pain level.
So I know that you mentioned a little bit earlier, and this kind of goes along with what my paper was about, but that sometimes you have patients who come in that are on pain medications, and kind of one of their goals is to see if increasing that mobility, that function, is something that they can do in order to decrease that medication burden. And in my paper about prescribing exercise for chronic pain management, that was a big idea that I wanted to propose is if we can get patients exercising, potentially seeing a physical therapist, potentially a personal trainer, depending on the scope, potentially decrease their medication burden. So have you seen that work with patients? Have you been able to work with any patients to help them kind of decrease the amount of pain medication that they felt they needed?
Sure. Oftentimes, I think that is being managed by their physician, trying to kind of wean them down. And so in conjunction with that, I might be seeing them not only to help them manage their pain through movement and exercise, but also maybe even trying to figure out the dysfunction that might be contributing to their pain. Or we're starting to know more and more about pain and what the involvement is with the brain, how we're perceiving our pain, what pain means, all of the different components that interact to the pain experience. So educating them on other ways to manage pain, and we know that exercise is a really good one. So certainly I'm seeing people that are trying to use less medication or maybe even trying to improve their function while they're on their current level of medication in order to start stepping down. And then I have maybe your post-surgical patient that has been prescribed pain medication because of their surgery, and then we're working on helping them heal after their surgery and get stronger and more movement so that they can obviously come off that pain medication fairly quickly and maybe just manage with something over the counter in the meantime or other modalities.
Yeah, that's awesome. I know my brother actually had reconstructive shoulder surgery, and he had to see a physical therapist 3 times a week. And he said that his experience with her was great and that he was happy to work on, getting that function back, but also having that decrease in that reliance on the pain medications because he was getting that function back. But that he also had exercises to take home with him and work on. And since I was there through part of his recovery, I was able to help him.
Yeah.
At what point are you saying, okay, you can take care of this on your own as far as your exercises, or at what point would you potentially refer them to a personal trainer to help them work out their exercises? Where do you think that transition occurs?
Sure. So I definitely think it's really patient dependent, and it's also kind of personal trainer dependent in a way. With a patient in particular, let's say they've been working with a personal trainer, then it's really easy to maybe have them continue to see that personal trainer, but work with that personal trainer to give them kind of a sense of what the patient can and can't do, or what their client can and can't do, or what they should be working on. Or if they're kind of taking a break from their personal trainer while they're in physical therapy, that's a person that I would be sending back to their personal trainer once I felt like maybe their pain was under control, or they were pain-free, or it was at a manageable level for them. We had kind of reached maybe a plateau or kind of the furthest benefit I felt like I could get for them. There's kind of a point in physical therapy where maybe they're not receiving as much hands-on care, maybe not as many manual techniques to help them improve mobility or range of motion or soft tissue mobility, and maybe they really do need just strengthening to really kind of get them fully back to where they need to be. And certainly at that point, if they've been working with a personal trainer, that would be an excellent time. If it's a patient that hasn't been working with a personal trainer, it depends too on the therapist. So the therapist's level of knowledge about fitness, because there are some therapists that are really comfortable with fitness and kind of personal training and exercise prescription, and there are other therapists that aren't as comfortable. So we might be getting them to a certain point based on their higher level of function where they still feel like they want to get stronger or want to have kind of recognized the positive impact that exercise is having in their life. And so that might be a point where if they're a person that doesn't feel comfortable doing that on their own, then it might be a really good opportunity to recommend that they have some sessions with a personal trainer, or that they find someone that they feel comfortable with to help set them up with a program.
And I know that as a personal trainer, I have worked with clients and we've kind of gone back and forth with some different pain that they're experiencing and kind of trying to toggle with, okay, what can we change around in our workout regimen? When should you potentially go see somebody? And I know working with runners, one of the biggest things is making sure that that strength is not all completely dominated in the lower half of your body, and just making sure we increased core strength, and that just improved running form. So we decreased injuries that way. But I do know that there have been times that I've been working with clients and they've been expressing that they're having pain, but based on the form that I see from a personal trainer scope, I don't see where the problem is. And so she went and she did see a physical therapist, and they had to take off her shoes and look at what her feet were doing, which is something that I couldn't necessarily see since we were wearing shoes when we were doing, you know, our squats and deadlifts and things. And it was something she was doing and turning her feet, and she didn't even realize it. And so going off of a story like that, when do you think is the best time, like a personal trainer who might have a client experiencing some pain, when do you think is the right time to initiate suggesting a physical therapist or seeing a doctor or something along those lines?
So again, just with all personal trainers are different in their scope of knowledge and educational background. So some trainers are amazing at picking out different things mechanically, or they're kind of up with the most current research when it comes to what might be contributing to certain types of pain. But I would say that if a client is if a pain is kind of nagging, if you've tried some different things and we're just not getting it to go away, that's when you probably want to see somebody. In the state of Indiana, they can come see a physical therapist without a prescription if we think it's just something that we can take care of in a few weeks. Otherwise, they would need to see a physician or a nurse practitioner or something like that to get a prescription to come into physical therapy. And like you mentioned, you know, as a physical therapist, we break down the mechanics of kind of what's going on, and we're looking head to toe at a person and trying to figure out where those weaknesses or maybe stiffness or, you know, different kinds of impairments might be affecting someone's function. So a person might be having knee pain, but the chances of it coming from higher or lower, above the knee or below the knee, are pretty high.
So yeah, I know especially in that situation, I was not sure, and we were both really open to the idea of her just going to see someone else. And then I've been working back and forth with what her physical therapist has recommended, and we kind of design her regimens based on that. But going off of that, is there anything else that you recommend outside of pain medications and exercise that you feel is helpful?
Sure. So we know that sleep hygiene, good sleep hygiene and good sleep health is really, really important to pain. Recommending different techniques to help with sleep, you know, a dark room, white noise, all of those things that might help a person get the best night's sleep possible. Also, just good nutrition. I will educate a patient with deep breathing techniques, or even encourage them to meditate in order to help with relaxation, which can also then help with pain. So certainly we know that aerobic exercise is really great to control pain. It helps with pain control and then function. And so, you know, there are a lot of components, even mentally or psychosocially, that we're looking at. Are, you know, do you have a good support system? Do you have people that you can talk to? Because being in pain, it affects every area of your life. So in order to help to feel maybe as supported as possible, not only with your own health, but your mental state and then other things socially kind of going on outside of yourself. All of those things are really important factors to keep in mind when we're talking about pain. And those are things that we don't always remember to think about.
No, I definitely agree.
Because we're definitely thinking about, you know, what's going on with our knee, what's going on with our back, but we're not thinking about all of these other things. Maybe they didn't get very much sleep last night because of they're worried about their job, or they're worried, all of these other components that are really overall influencing them as a person.
I definitely think that's kind of the push that healthcare is making now, is really realizing that there's more components based on just what we've been taught to look at as far as their injury, but looking at the person holistically is like a very holistic approach to that pain management. And I know you mentioned this earlier, that some physical therapists are really comfortable with the idea of exercise and incorporating that into your daily and your normal life routine, but that some are not necessarily as comfortable with that idea. And what do you think we need to do as just healthcare providers to kind of increase that awareness and increase the comfort with the idea of exercise?
Sure. I think it's like the utilization of it, and just more education, and recognizing what I think is so great about healthcare is kind of physical management of pain, is that it can be a continuum, right? So, they can be working out with a trainer, having some pain that's not getting resolved with that exercise, and so they come see a physical therapist. A physical therapist can then refer them back to a trainer, or maybe if they're an athlete, some kind of sports performance or agility or higher level activities to really push them forward, and they can kind of work back down the chain at any time that they need to in order to meet their goals. If we're talking about just kind of your average person, I mean, it's all the same. You had a patient that was a runner and was training for a race, I'm sure, or something. So it's important to, as a healthcare professional and as a physical therapist, if you have an interest in fitness, I think that that's something to pursue. If you're a trainer and you have an interest in helping with a little bit of injury prevention or rehabilitation, then that's something to pursue as well. Like, there are a ton of Instagram accounts, or
sure.
that where I follow trainers who give great exercise recommendations for certain types of pain. And if I'm just an average person and I'm following that account and I'm having some back pain, maybe I'll try some of those things. And if it's not working, then maybe I seek another healthcare professional. But so I think pursuing those interests is important, and then knowing your own limitations. So knowing when it's a good time to refer to someone else. If I have a higher level athlete, then knowing when they've reached the point that they need someone with, more knowledge in that sport or in that kind of training, knowing that it's time for me to refer to someone else. I think that's important for everyone that's dealing with a person in pain.
Yeah, it's kind of knowing, okay, this is out of my scope now, and trying to move forward with that. Well, I appreciate your input so much. Thank you so much, Cris, for coming out for my podcast.
Yeah.
Is there anything else that you'd like to add?
No, I think we had a good chat and really well-rounded conversation about pain and especially with personal training and physical therapy and how that works together.
Yeah, they do work together a lot, and I think that's something that we don't always notice, but I've been really fortunate in my experience to be able to work alongside and get some feedback from physical therapists such as yourself. So thank you so much for coming out today.
You're welcome.